Thank you, and good afternoon. Let's jump right into the new numbers we have. We'll pull up the first chart here. And before we go into the numbers here, I just want to caution everyone that the numbers, again, on a day-to-day basis do not tell us anything significant other than we have continued spread. You'll see in today's number, the number is down a little bit from the previous few days. That in large part probably reflects a lag or delay in testing. You'll recall a few days ago we talked about the limitations on reporting and testing. And so even though the number is down a little bit, we still believe that this is a growing situation and we need the public's continued commitment, not necessarily to make decisions or assumptions about what's happening day to day, but to recognize where we are in this process relative to many other jurisdictions that are struggling. It is still early. We still have wide community spread, and the adherence to the social, physical distancing efforts and hygiene things are most critically important now. But we are reporting 31 new cases for a total of 519. Second slide goes to testing. And again, we're reporting 1,275 tests from yesterday. These are tests reported to us. Some of this is impacted by the delay of a few of the systems we talked about over the past few days. And so we hope to both get the reporting back online while we also have additional testing coming online, and we will keep you posted of both of those each and every day. Moving into a couple other quick updates, our efforts surrounding tackling the issues surrounding homelessness continue. We are in ongoing discussions with the mayor of San Diego, along with the Regional Task Force on Homeless, surrounding an integrated regional effort and approach. And we hope to have a more specific update on the efforts and actions that are coming in the few days, hopefully as early as tomorrow. Our motel room count currently stands at 2,026. 1,585 of those are public health rooms. Out of those rooms, 112 are currently occupied, with 109 of those coming from our unsheltered and homeless population. The entry point into those public health rooms both coming from our public health nurses who are embedded in our shelters, along with referrals from the public health nurses who are with our homeless outreach teams. We've also allocated 441 rooms, motel rooms, to the Regional Task Force on Homeless to fill consistent with their protocols. Of these, 170 of those rooms are currently filled. We are working with the state of California today. The governor made a series of announcements and executive orders, primarily surrounding healthcare workforce and staffing. We are in daily communication with the state around the integration between what we're doing and what the state of California is doing. And tomorrow we'll provide a little bit more updated information surrounding our efforts to both raise the bar of hospital room capacity along with raising the bar of available rooms within our healthcare system, and how all of that is consistent with what's happening at the state of California, and in many ways how our efforts here locally are benefiting from the actions of the state of California. Today we are issuing 2 new public health orders related to cruise ships. San Diegans are certainly willing to be good partners and neighbors and do our part to provide humanitarian assistance, and we have certainly done that. As a region, we received the repatriated flights of individuals from China into Miramar. We received the repatriated flights of cruise ship from the Princess Cruise Line, who docked up north but then flew to Miramar. And we have received now, I believe, 5 different cruise ships that have arrived in our ports. And we're issuing 2 public health orders, one to limit the arrival of future cruise ships, and the second one is to provide better controls and parameters to ensure the orderly disembarkation of staff and crew of those cruise ships that are already here. And here to brief us on both of the public health orders along with cruise ships is Dr. Eric McDonald.